She has a hollow right along here, but she actually has a little hollow right here too. That's just her bone structure and the way she's, you know, put together. We're all a little different. So I'm going to fill all the way from here all the way down through here, and I'm going to fill this way a little bit too, just so the cheek transition doesn't have a step off. It goes nice and straight and smooth right to the lower lid. I'm going to dilute it. This is Volbella, this is Saline. The reason we do this is because Volbella has a tendency to draw a little water, and every once in a while you get someone who gets a little puffy after the fact, even though it seemed like it looked beautiful at the time of. So if you add the Saline to it early, the chance of that happening is way less. Sometimes you have to come back and do a little touch-up because you undercorrect it. So I like, this is a 30 gauge needle, 1 inch. It's a very small needle and it's longer. The reason I like it is because I have a technique, I like to do the fanning technique. It means I can do fewer pokes to do the same thing, and also I can move more with each injection. As long as you're injecting and moving, the risk of filling a vessel with a fair amount of volume is almost non-existent because you're constantly moving. Volbella is very thin. It like injects very easily, especially after you dilute it. So this gives me a little more control, gives me a little more back pressure. When you look up at the ceiling, you can see more of the hollow. Here comes a little pinch. I want to go pretty deep here under the muscle. See already there's an improvement, just that one little pass. I may do more, but start there. And then right here, pinch. Put a little pressure here just in case there's a little full spot, a little blob. You can kind of press it down. So you already see it's much better. I'm going to put a little bit more here. Pinch. So when it's diluted, you can inject to a full correction, not overcorrection, because you can pretty much count on it settling down and going away a tiny bit as the saline resorbs. You definitely don't want to overcorrect. So you can see that's, I mean, it's a pretty good correction. She could probably use even a tiny bit more, but again, I'd rather be conservative and undertreat than overtreat. I can always put more in. It's much more difficult to take it out. The other side now. Pinch. Pinch. Up here, pinch. A little more right here, pinch. Put this in. Try to side. We'll put a tiny bit more. Where am I going to put it? I have like a tiny drop left. Chin up for a second. That's pretty good. Use tiniest little bit, right? And here maybe. Pinch. That's it. All done.
Let's see. Oh wow. That's a big difference. That's a really big difference in how hollow my eyes were.
Mm-hmm.
Wow.
It doesn't take much to make a nice little change.
I mean, because colors, that doesn't always go away, but just not being so sunken in, that makes a big difference. Makes my cheeks look less so bulbous.
Yeah. The face all is it's all about contours.
All right, smile. You're happy.
Yeah.
I think it was
And
good.
even like when I smiled before, it was just so.
Yeah, just like I
Yeah.
guess because you had that line.
Yeah, because I had the line.
That line is mostly gone. Most of this